This is our story of the challenges faced and lessons learned as we dealt with my husband's mental health crisis and treatment of major depressive disorder. I call it the costly broken path to care, and what I am sharing happened in 2011 in Massachusetts. I hung my head in frustration, unable again to reconcile our monthly budget, when my then very ill husband asked sincerely, "I don't understand, where is all of our money going?" I don't remember answering, but I do remember running through the calculations in my head. He hadn't worked since the day of his mental health crisis the year prior. He was generally on 3 medications at a time, and one of his medications had a $50 copay. We had copays for about 13 mental health appointments each month. We were blindsided by unexpected expenses like ambulance fees for transport to local psychiatric units. I don't know how I made it into my 40s not knowing that insurance didn't cover ambulance rides, but they don't, or at least they didn't for us. When my husband broke, our life changed financially overnight. The expenses piled up quickly and they weren't optional, not if I wanted my husband to live. Dealing with the loss of income and added expense was painful, but it took second place to the devastating day-to-day pain of living through a mental health crisis. After all, money is just money, and people are irreplaceable. I could not have anticipated how much time I would spend to get him the treatment he needed. Waiting in emergency rooms, attending mental health provider appointments, participating in family meetings, searching for and staying in contact with providers, and talking with insurance companies. Together, this time commitment is daunting. I was so fortunate that my job allowed me to spend time coordinating his care, making phone calls to insurance companies and providers, pouring through expenses, organizing rides, and scheduling visits to reduce the time he would have to spend alone. I know this is a luxury many don't have. Not only does dealing with a mental health crisis take an emotional toll, it's also somewhat cruel that at the absolute darkest point in life, you must advocate for your own care or advocate for a loved one's care. Many times I desperately just wanted to stop and cry, but I believe that if I stopped trying to figure out his care, he might not live through this. Carrying the weight of his incapacity, ensuring he was getting decent care, getting care for myself, holding together the finances, attempting to be a reliable employee, it was all almost too much to ask. But while the costs for mental health treatment are steep, the path to finding care is also unpaved. We always encourage people who are struggling with mental health issues to be brave and to reach out for help. I agree with that. Yet getting help is hard. On a good day, it can be confusing to understand how insurance works and what it will cover. In crisis, it's nearly impossible to sort out. When my husband's initial episode occurred, his mind was delusional and his behavior was threatening. I had never had reason to fear my husband, and now, watching as he was restrained and loaded into an ambulance, I was terrified at the thought of ever being in the same room with him again. In the heat of the moment, I didn't think about which hospital the ambulance would take him to, or about the expertise or experience of the staff that might be assigned to his care. So when the hospital called a few hours later, telling me he was ready to be picked up to come home, my heart sank. Did they not know what we had just been through? Why would they release someone who was still dangerous? Soon after, my husband called me directly to confirm that he could come home. His voice was not his. His tone was all wrong. I did not think I had a choice, so I gathered up my courage and drove to the hospital to pick him up. I don't know whether it was the hospital staff's lack of training or something else, but 2 things happened because my husband had not been properly assessed for safety. I left that visit with bruises and a new trauma, and my husband was admitted to the hospital. A new chapter began. Being new to this situation, I had no idea how insurance worked for psychiatric inpatient care. I soon learned that our insurance initially covered only 3 days of care, extended for another 3 days at a time based on reevaluation of his condition. I was worried sick about him and not able to plan more than 3 days ahead, but at least he was safe. Although my husband's delusions had not lifted, and I had not been alone in a room with him since he was pulled from our home, the hospital staff began talking to me about releasing him. I asked where he was going to be discharged to, because surely after what I'd been through, they wouldn't expect me to take him back into our home when he was still fully delusional. I could not believe it when the doctor said simply, "That's not my problem." I know now that our insurance had stopped paying for care, so the doctor didn't have much of a choice, but some compassion would have been welcomed. I spent hours on the phone with our insurance company that day, pleading with the behavioral health representative to keep him in the hospital until he was more well. She assured me that they would pay for him to be there until he was safe. I'll be generous and say she was mistaken. The hospital released him in full delusion to his sister's home. When he showed up for his day program at a different hospital 2 days later, still incredibly disoriented and confused, they immediately admitted him, even before getting approval from insurance. It was a relief that this hospital staff said they couldn't, in good conscience, release him to the community. And I finally saw what it looked like to have a strong, compassionate team gather around someone suffering a mental health crisis and walk him toward hope. The insurance company eventually agreed to cover the cost for this second hospitalization. I had so many questions when figuring out providers for my husband's outpatient care. How are we going to find the right providers? Who would take our insurance? Would these providers really provide? By the time my husband was ready to leave the hospital, his mind was clearing and his biggest issue was a deepening depression. Although the hospital set him up with both provider and prescriber appointments in the community, we learned pretty quickly that assigned providers are not always the most fitting, just the most available. The first outpatient prescriber put my husband on a medication, which was known to take about 8 weeks to begin working. 8 weeks. This didn't seem like a good option for someone who wanted to die every hour on the hour. But again, it didn't feel like we had a choice. After 8 miserable weeks, we asked this prescriber to consider another medication. He begrudgingly wrote a different prescription. There were complications. We felt stuck, scared to stop the medicine and scared to continue it. When we finally made contact, this prescriber put my husband back on the first medication, quality of life be damned. When we asked if there was any other medication we could try, he simply said, no. Really? Don't ever tell a traumatized, sleep-deprived wife fighting for her husband's life and armed with Google that we are out of options after trying only 2 medications. Just don't. I began making plans to find another prescriber. Meanwhile, the assigned therapist wasn't resonating. A few weeks later, I found out why when I invited myself to sit in on a session. In more ways than I care to detail, this provider wasn't professional, oversharing his experience, giving bad advice, and yelling at my husband. It was time to leave that practice. The systems set up to help us weren't doing a very good job. The search for a strong treatment team began. We changed therapists and prescribers several times that year. We changed because some, like those mentioned above, seemed incompetent. Others along the way weren't as bad, but they seemed to lack true concern for who my husband was before the break and for the person he could become. They didn't seem invested in his care, so the care they provided was sloppy and generic. In my opinion, they had written him off. Even though they didn't have any expectations for his recovery, I still did. I searched through lists of providers from our insurance company's website and cross-referenced the names with word-of-mouth referrals from friends, neighbors, coworkers, and anyone else who said they knew of mental health providers who had been effective. I took detailed notes as I worked my way through pages of recommended therapists and prescribers, calling them to explain my husband's current state of mind and asking about their experience and interest in treating someone like my husband. If their wait lists were full, I'd ask, who would you recommend I call next? Over the course of the year, it took research into at least 12 providers to find people who were competent and fit our criteria. It was not easy. 3 prescribers, 2 therapists, 4 hospitalizations, and almost a year later, we had assembled a team that worked. The therapist we found treated my husband like a human being, and insurance covered all but the copays for these visits. He truly wanted to help us, showing again that there are pockets of kindness along this journey. The prescriber we found was just as amazing. We connected with him strongly at our first meeting, only to learn that he could not take our private insurance because my husband was also covered by Medicare. After the prescriber explained this to us, I sat in my car in the parking lot and wept for an hour. I felt like we had finally found someone who could help us, but we couldn't access him. A week later, I called this prescriber to ask if it was allowable to pay out of pocket, and if so, what would the rate be? It was $250 for the initial consult and $75 per session. We decided to make it work, and we now pay out of pocket. At first, seeing him a few times a month was hard and expensive. Now we go every 3 months, and it's more doable. Most importantly, the prescriber is thoughtful in the way he works with my husband to make treatment decisions, and as a result, the treatment has been really successful. The decision to pay out of pocket was one of the best decisions of our lives, and I accept it for the privilege that it is, knowing that this option is not available to many others who don't have any extra income. The scary truth is this: our mental health system is broken. Hospitals will keep us only as long as our insurance pays them. Our insurance determines which providers we see. The quality and type of therapy we receive are determined by the individual therapist we are seeing. The medications we are prescribed and the order in which they are offered are determined by the professional preference of the prescribers that we see and the requirements of insurance. It's all connected. Insurance companies are the gatekeepers of our access to providers, and I have many doubts that the needs of patients are priority as decisions are made about who can see which providers for how long and at what cost. Prescribers are the gatekeepers of our medication options. We can only hope that they are driven by their own passion for the field and their ability to see each patient as unique and worthy of relief. It's been my experience that those of us who must interact with insurance companies and the mental health care system can be doubly traumatized. First, by the actual mental health issue or event, and then by needing to navigate the cost of care, make sense of the rules that hospitals and insurance companies must follow, and finding effective therapists and prescribers. We wouldn't tolerate a medical system this broken. We require doctors to treat people needing emergency surgery. We would file a complaint if a doctor tried to send us home without stopping the bleeding from an open wound. Our experience showed us that the mental health care system is broken at many levels, but also that there exists, at least in small pockets, groups of dedicated staff who know how to work around the broken parts of the system to help put people in crisis back together. I sometimes close my eyes and think of how things might have been if my husband had been brought immediately after that first psychiatric event into a hospital that understood what he needed, surrounded him with care, kept him until he was well, and then handed him off thoughtfully to a provider and prescriber team handpicked with his success in mind. I hope someday that those who go through what we've survived have it a bit easier. I hope loved ones don't have to lose sleep about the cost of care or have to question the compassion of their insurance company or the competence of a provider. I hope no one else has to feel defeated trying to answer the question, where is all of our money going, while doing the best they can. This was not to be our experience, but someday, if we keep talking about it and keep working on our broken selves and our broken systems until they are made whole, maybe eventually there will be a well-traveled path to care that those who come after us can easily find. Until then, let's keep helping each other find the way through to healing along this broken path of care.